Hello, everyone. Welcome to our Move for Health Movement is Medicine live stream. We are so glad you could join us today. We have a really exciting educational experience for everyone today. We will be speaking with Dr. Ho himself, and basically, we're going to talk about the importance of incorporating movement into your daily life and really just what that means for your health and well being. So, let's talk about what is movement is medicine. So please welcome Dr. Ho to the chat. Dr. Ho, thank you for joining us.
Hi, Kathy. Hi, everyone. Now, we have to understand the body is a dynamic machine, okay? You just check your pulse, okay? You just touch your wrist here. You can feel the pulse, or touch here, you feel the pulse. That's your heart at work. Your heart is going boom, 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 okay? It's pumping blood to the arteries, okay, through the rest of the body and return through the venous system, okay? So we need circulation in order to stay alive, in order to nourish the cells, in order to clean, the cellular at the cellular level. Now, we also have what we call lymphatic system within our body. There's little tubules, if you want to call it, little tubules of network where fluid, okay, can drain through the tubules throughout our body. That's why we need movement, because the lymphatic system requires muscle to contract around it in order to push the fluid from our feet, from our legs, back up to upper body. That's how the body cleanses itself, okay? So yes, movement is very important for vascular health, for lymphatic circulation, for artery and venous circulation. Now, if you're a type of person that sit all day, well, that's no good, because now you only rely on your heart only to get all the circulation, to maintain all the circulation. And that's why we need movement within our muscle to help the heart to keep the arteries and the veins and the lymphatic system, flowing nicely. Another thing is motion is lotion, okay? That really means is within our muscles, okay, they make up of fibers, little, fiber muscle like this, strands of muscle fiber. If the muscle's not moving, they can actually become adhesive, okay? Little scar tissue will start to make the muscle very tight. And over time, they can actually become shortened because they contract on themselves. And that's why if you sit for a long time without moving, okay, or if you strain yourself by holding one position, your muscle can become hard and tight and sore. So we need to move the muscle on a regular basis to move the muscle fibers to keep them nice and supple and keep them nice and so they don't become tight, hard, which also causes poor circulation, which also causes inflammation, lactic acid that can cause pain and soreness. Now, tight muscle can also pinch nerves, which can cause, say, if you pinch a nerve here, you can get headache, fatigue. You pinch a nerve here, you can get numbness in your arm, trouble lifting your shoulder. You pinch your nerve in your low back, obviously you get low back pain, but you can also get numbing pain in your leg. And that's why we need to move our muscles on a regular basis, okay? Unfortunately, with us sitting all the time, we don't move enough. So I recommend you do some exercise, okay? If you have time, first thing in the morning, do some exercise. At the end of the day, before you go to bed, you also do some exercise. Before you have that long period where you're sleeping and not moving. And if you're at your desk, get up every half an hour, okay, to move and lubricate your joints, to move your muscle. Now, speak of the joints. Joint is basically let's think two pieces of bone joining together, but it's not bone on bone. At the end of the bone, you have a layer of smooth cells called cartilage. Now, cartilage, they don't have a blood vessel that nourishes them. They need the fluid in between the joint, okay, inside the joint, and this fluid is called synovial fluid. It's almost like a lubricant, a washing fluid, and a nourishment fluid. So the cells of the cartilage only gets that nourishment and the washing effect and the healing effect, if you want to call it, the regeneration effect with this movement. So again, if we sit all day and we don't move those joints, the cells can actually deteriorate, and then you can get what we call premature degenerative arthritis, because the cartilage will not regenerate cells. So you wear it out, you don't regenerate new ones, then eventually you're going to lose the layer of smooth cartilage cells, and then there'll be bone on bone, which can be very painful, inflammation, and cause you to lose your mobility. So what should we do? At the office, okay, if you're sitting, well, if you can't even get up, just move your leg. Okay, it's like when you move, you pump your ankle every half hour, just do 10. Just simple movement like that, right? Will do you a lot of good for the muscles and the joint. And then now, for those of you if you cannot do the exercise you want, you cannot, walk or cannot do, go to the gym. When you sit, I do suggest you use a motion sizer because it keeps the ankle, knee, hip joints moving. It keeps the calf muscle, the shin muscle, the quad and hamstring muscle moving. So again, it keeps the muscle relaxed, lubricate those joints to keep them loose, and keep the circulation flowing nicely. And then it's got the heat, which also help to open the microcirculation at the bottom of your feet to warm up the feet and open the blood vessel, again, increase local circulation. Now, I also recommend that you do a routine stretch. I do this every day, okay? I'm just gonna show you very simple because the key is to stay feeling good and comfortable with minimal time and effort, right? So once your legs are nicely warmed up, you can just kneel down, okay? And then what do is straight out. And then just gently lean on it. Now, when you first start this process, okay, you probably won't be able to get your foot flat out like this, but just gently sit on it. Just let your legs go loose. Just gonna pull on your hamstring to loosen up, the quadricep here, to loosen up the quad muscle, the thigh muscle. It will also stretch the shin muscle and also stretch the ligaments that bind your ankle together, which is very important because if you do this regularly, you're not going to sprain your ankle so easily. So do this for 10 or 20 seconds. So very simple from this position.
Oh,
Toes up, and that can cause arthritis. And when your toes are stiff, it slows you right down. You lose mobility, you lose speed, you lose agility. So for place, this is very important. Those agility in the joint that allow you to move quickly and without causing injury. Okay, so that's very simple. Now another movement you do from here is just sit on your buttock. Okay, right there. You're not using any muscle. You're stretching all the ligaments in your knees, in your ankle, and in your low back. Okay, so you just kind of let the body relax like this. Now, for a lot of you, you have very tight calf muscle because from the shoes you've been wearing, high heel shoes, or you never stretch this way, it's going to be very difficult for you to sit down. But I find over time, if you could do this, you're going to have a lot less back pain, you have a lot less cramping in your calf muscle, and you're going to have better posture just because the lower leg is more flexible. Okay, so very important to do this. And just give you a quick one. The wrist, a lot of people lose the movement in their wrist. I've seen that in many patients. Okay, you should also stretch your wrist every day because the movement of the wrist allows you to work your hands better. So you want to do this and your knuckle joint and finger joints. Make a fist and put weight on it to just basically flex those joints. Again, we want to maintain mobility in all joints. I'm going to show you one more. That's very important because I see a lot of patients, especially as they get to middle age or older, they actually have trouble putting the socks on because they cannot bring the leg up this way. So I suggest you start now while you can, okay? And if you have trouble, just slowly get there. Bring your heel up to your thigh and just gently bounce this back and forth like that, okay? That's very important to stretch your hip joint. So again, to reduce chance of developing hip arthritis when the muscles loose there, and allow you to stretch your knee, and allow you to be always able to put your socks on. Remember, you don't lose movement overnight. You lose movement over the years. But if you regularly stretch yourself, you're going to maintain those movements throughout your entire life. Now, while you're here, again, we want to move the toe joint. Very important. I'm very surprised when people don't move in the toes and they have trouble walking. And when you go back to motion, it's lotion, okay? And movement is medicine. If you don't walk, if you cannot walk fast, you're not going to be as healthy as someone that can walk strong, fast, with agility. And that's the key to good health and a good life, is to stay mobile, okay? So I'll move my joints twice a day at least, okay? I use the motion sizer, I use my pain therapy, and I stretch my joint every day. And I move the joints against each other. I want this movement, okay? And I move the forefoot against the hind foot by twisting my foot like this. okay? And I need the bottom of my feet because those little muscles inside, I want to keep them nice and supple so that my feet is agile. I can feel the ground, I can move fast, and I can play sports, all right? So, and you get cramps in your calf, you massage your calf muscle. A simple routine like that, and using a machine like the motion sensor and your own regular exercise can keep your muscle nice and loose, your joint nice and loose, and your ability to move the way you should to stay active, healthy, and do things with fun.
That is so wonderful to hear, Dr. Ho. I think you've given us some really great ideas. And I love the concept of movement is medicine and motion is lotion, because I think you're right. I think there is a lot to be said for daily movement, daily motion. I love the stretches and exercises that you just showed us. Now, we did have a question from the chat. We have someone who is we have someone who was basically wondering, let me read this. My mother is in a wheelchair. Is this something she can use? So that was Gregory. And I think there's something to be said for a lot of people who maybe aren't getting the movement. So maybe people who are at their desk all day and aren't able to get out and move. Maybe people who aren't as physically fit as they once were, or even people who, like Gregory, his mother's in a wheelchair, or even perhaps people who, I know you're down in Florida right now doing shows down for live shopping down there, but up back here in Toronto, it's cold, and I know a lot of people don't like to exercise. So what are your suggestions for people who maybe aren't getting the movement that they would like to be getting because of weather, because of physical conditions, because of work?
Gregory, that's a very, very good question. Okay. I had a lot of patients and customers around the world who are wheelchair bound. And as people get older, they tend to have issues with, with joints, with hips, with sciatic nerve issue, and they stop walking. And once you stop walking, you walk less and less. So for someone that have mobility issue like your mom, I definitely recommend she use the motion sizer, okay? And she can use it several hours a day. She can use it, while watching say a TV episode, or while she's having a tea or reading her book. And by putting her feet on this, the machine move her joints, move her muscle, and promote better circulation for her. Because the fact that she's sitting in a wheelchair and sitting for long hours every day, she need help. She need the machine to help increase the circulation and bring the blood and the fluid from her leg back up to her upper body, which will take the pressure and the stress off her heart. Okay, so very important. Now, besides the feet on the motion sizer, I recommend that she would do some exercise with her upper arm as well. Just simple. Like I say, punch in the air. Punch in front. Okay, and just squeeze, open, squeeze, and just some stretching of the wrist. You want to keep things moving. Okay, so yes, have your mom use the motion sizer, do the knee movement, if she can move her legs and then move her arm. She does it, throughout the day. She's gonna be feeling a lot more, comfortable. She's gonna be feeling a lot healthier, and with time, it's gonna slow, things from deteriorating rapidly. So very important for our senior friends who sit for all day or people with mobility problem like your mom. Thank you for the question.
That was a great question and a great answer, Dr. Ho. Thank you so much. We're actually getting quite a few questions from the chat right now. So we have one from Bruce that I think kind of incorporates into this, but maybe you have another suggestion that you can share as well. So he's asking, what do you suggest for foot arthritis? And I don't know if some of the stretches, and I think that like massage you were showing with your foot, if that would be beneficial as well, or if there's something else that you recommend, Dr. Ho.
For those of you, and Bruce, that's a very good question, because a lot of folks have arthritis in their foot. They don't know what to do. It gets worse. But if you do something every day, you're going to get better and better. Okay. So what I recommend, motion sensor is good, but we have another device called circulation promoter. It's designed specific to reduce the inflammation in the joints and relax the muscle to relieve the pain. Okay. So you should use a circulation promoter if you have arthritis in your feet. Now, using the machine alone is good, but not enough. You definitely want to move the joint. Now, a very common place for arthritis is right here, first toe. This joint, because the type of shoe we wear, especially ladies out there, the toes are restricted. They point together, and it changes the angle of this joint. So if an angle normally, it's nice and lined, but you switch, you twist it and you keep rubbing it, obviously it's going to get inflamed, inflammation in the joint, and the bone will change shape. Okay, you get osteophyte, and then become very painful. So I suggest, okay, move that joint just like this. I don't know if you can see. Let me use this foot. Okay, so can you see that? Okay, yeah. You just move this joint back and forth, back and forth. Okay. Now, at first, there's going to be some minor aches and pain, but you want to do it. You want to increase the range of motion, because movement is like that. The more you move, the more you will be able to move. And the more you rest it, the less it will move. So do not rest, okay, if you have pain. I suggest you do more movement if you have pain to increase the range of motion, so you will actually use your body more and more, less and less, okay? So if you have joint pain right there, just move it. If I arthritis in the ankle, okay, I will stretch this way, I will rotate it this way, and also do the stretch I showed you earlier to increase the range of motion. When you have better range of motion, you have less arthritis. If you have restricted joint movement, you have more arthritis. It's that simple, all right? And you want to also just loosen up the bottom of your feet with the circulation promoter and also with your hand, okay? You do both to increase the suppleness and the mobility of all the joints and muscle in your feet. And then when you walk, the feet's gonna act like a shock absorber, and it's gonna be much more comfortable and less painful for those arthritic joints.
Well, I hope that answered your question, Bruce. So we actually have a hop-in chat today, Dr. Ho. We've got lots of questions, so I'm going to try and get to everyone's questions as soon as I can and circle back. Gregory, we are thrilled to hear that your mom is using our pain therapy systems and the pads help with her legs, back, and neck. And I know that Bharat has a question as well about the motion sizer. So Dr. Ho, two questions for you. One is related to our pain therapy systems and using the motion sizer at the same time. So can someone use the pain therapy system with the motion sizer, or do you recommend doing one then the other? And then the second question is from Bharat, and they want to know, let's see, how long can I use this? I sit at work at the computer all day. Can I use it while I'm working? Absolutely, 100%. You can use it while you're working. Or should I just use it after work? I use it while I'm working. My husband uses it while he's working. It's absolutely something. It's quiet. You can stick it under your desk. You can use it. So I actually answered that question, Dr. Ho. But if you can kind of address like motion sizer and our pain therapy systems, is it better to do one than the other? Can you use them together? Can you kind of help answer that for us? Thank you.
Differentiate the two different machines. The motion sizer is a passive motion exercise machine. That means it'll move your joints and muscle repeatedly in a very small range of motion to help lubricate the joint, to keep the ankle, knee, and hip joint loose. It also moves the muscle again in a very short range of motion to help loosen up muscle and to relax muscle so your muscle recover faster while promoting increasing circulation from your legs to your upper body to help support your heart's function. Now, but if you have pain, you need the circulation promoter pain therapy system, because that is a nerve muscle stimulator. It's got what we call AMP pulses, auto modulating pulses, that stimulate the nerve and muscle at the bottom of your feet and the rest of your body, depending where you put the pads, okay? And that helps to relax the muscle and relieve the pain, okay? So if you have arthritis or if you have foot pain, you definitely want to use the circulation promoter because that's more designed to relieve the pain. Now, you can definitely use both, okay? I would suggest you use the circulation promoter pain therapy system, say for 30 to 40 minutes, 2 or 3 times a day, depending how much pain and how severe your pain is. You can definitely use it longer, but most people feel significant improvement after 30 minutes. Okay. So circulating promoter, say 30, 40 minutes, 2, 3 times a day, longer if you need it. Motion sizer, yes, I have this under my desk. And after I love to play basketball, and my leg gets quite sore after I play, and they feel tired. But then I usually have a game again the next day. So I would have this under my desk. I will use it 3, 4 hours, okay, while I'm working, and my legs feels great while I'm using it, and also feels a lot better when I'm finished, okay, because it helps the muscle and the joint recover faster from overwork. So yes, I hope that answers your question. You can use both, but use it different times.
Okay, so yes, to clarify, Gregory, thank you so much for your follow-up question. Yes, we do recommend you do them at separate times. So maybe do, as Dr. Ho suggested, a 20 to 30-minute session she can do with the circulation promoter with the pads. And then in between using the circulation promoter, something like the motion sizer to help keep her feet and legs moving using that passive motion exercise, or really if she just wants to enjoy the heat. I know with Barat, one of the things I love about using the motion sizer under my desk is, it has 10 different vibrational speed settings, but it also has 5 heat settings. So I really like just having it on, keeping my legs moving while I'm at work, while I'm at my desk, but also the nice hot feet. So to have it on and to be able to keep my feet warm is a really nice a really nice feeling as well. Bruce, I'm thrilled to hear you already got your circulation promoter so that you can start using it right away. So um, thank you everyone for your amazing comments in the chat today. It's really great that we're having this opportunity to do this one-on-one with Dr. Ho to learn about movement and moving for health, and as Dr. Ho said, why it's so important that we keep moving even even if there's reasons why we can't, if we're in a wheelchair, if the weather is maybe not cooperative, or if there is something that is maybe stopping us from getting that movement. There are little things that we can do. Dr. Ho, can I trouble you to show us maybe one more stretch or exercise as a final wrap up, just to keep the heart moving from sitting? I know you did a few things a few minutes ago, but if you could just do kind of one final, as you're sitting, maybe you're using the motion sizer, maybe you're not, but maybe just one final, what's a really good movement to get the blood pumping? And then we can see if there's any last questions we can wrap up.
In fact, I'm very glad, Kathy, I'm really glad you asked that question, because I've been wanting to show our friends out there one more exercise that we should all do, okay? And especially if you have arthritis or pain in your hip or in your knee. This movement here, again, easy. Just support your weight, okay? Support it so you don't fall, and just gently swing your leg back and forth like a pendulum. I had many patients who suffered arthritis, and this again it's a nice gentle movement on the joint and a nice gentle movement on the muscle, and it helps to lubricate the joint and nourish the joint so that we get rapid healing. And don't forget, cartilage, especially if it's not severely deteriorated, can actually regenerate. We can actually get a new coat of cartilage if you do enough passive movement with this no pressure, non-weight bearing movement. Okay, it helps lubricate the cartilage cells, nourish them, and a new coat of cartilage will regenerate. Now, it doesn't happen overnight, but if you do this regularly after 3 or 4 months, especially if you use a motion sizer or the pain therapy electrical stim on particular joint, you will find your joint pain will be substantially reduced. Some of you might get rid of it. You'll find your muscle become more loose, and some of you may actually feel your joints actually more smooth with more agility. So yes, this is something you can all do. Just stand up maybe half hour, just move your leg and your hips about 10, 20 times, and it'll do you a lot of good. Try this. Oh, we're back. Okay. Hello. Well, we went off air for a little bit there. So I think Kathy's trying to fix things on her end. I don't know if you're hearing me, but if you just joining us or if you've been watching, I'm using the motion sizer. It's a passive motion exercise machine that can help to lubricate and loosen up your joints, the ankle joint, knee joint, hip joints, and also help to move the muscle to help them relax and help them refresh better, say after workout, after exercise, or just from sitting for long hours. This also help to support circulation between your legs and your upper body. So keep things flowing as you sit. And for those of you who sit for long hours, whether it's in the office, wheelchair, or as a driver or student, I highly suggest you use the motion sizer on a regular basis just to keep your legs feel comfortable, keep them feeling good. Okay. Now, besides using the machine, we also suggest you just do some, large movement exercise while you're sitting in your chair or sitting in office, pump your ankle, move your knee joint. Just large movement also is very good for you. So just keep doing something like that. Also suggest you do some stretching. Okay, stretching of your foot, all the little joints in your feet, massage the muscle at the bottom of your feet, just move the midfoot against the hind foot. All those movements can really help to keep your legs and feet healthy and feeling good all the time. And that's what I do. I try to keep my muscle and joint moving so that I continue to move, enjoy walking, playing sports, playing with grandkids, just do all the stuff that I like to do with my body, with my life. You need a body that can move in order to enjoy your life. Yeah, try this.
Thank you, Dr. Ho. Sorry about that, everyone. We had some technical problems. But I'm thrilled that we had Dr. Ho with us today to really share that amazing information. Thank you, everyone, for joining us. And I think we can all take something from what Dr. Ho said, and that movement is such an integral part of enjoying our lives with our friends, with our loved ones. And we hope that you will take that to heart today and that you will join us for our next live stream. So bye here, and we'll just give Dr. Ho a chance to say goodbye as well.
Thank you, Kathy. Thank you, everyone, for watching. I had a lot of fun and sharing, with you information I feel that can improve your health and your life. So until next time, take care of yourself.
All right. Bye, everyone. Thank you.